Hi, I'm Dr. Frank Lusby. I am the Envision Medical Director for their two centers at Torrance and Fullerton. I've been with the company since 2001 when it went under a different name. But in any case, of the 85 surgeons in the group now, I'm number 2 in terms of longevity, good or bad. I've been doing LASIK surgery since, as it turns out, 1996. So I've had a fair amount of experience, which has been a good thing. And it's the primary focus, really the only focus of my practice at this time. And it is a very rewarding career for me in terms of the patient satisfaction and the outcomes that we're able to give to people with their vision. Well, I grew up on the East Coast where I did my undergraduate schooling. I came to Loma Linda for medical school. After Loma Linda, I went back across the country to do my internship in Boston. After that, because I like to drive, I went back to California for my residency, which was in Los Angeles. After that, I did a fellowship in anterior segment surgery. That's things like cataract surgery. There was no such thing as LASIK at that time, I have to admit. And then stayed with that practice early on and became the one that started up the refractive surgery program back in the days when all we had to do was this thing called radial keratotomy. So one thing kind of led to another, and I advanced my focus into the laser procedures when the laser became available. So in 2001, I joined what would later become Envision. And the primary reason for that was because the focus of the company was on what I wanted to make as my practice focus, which was refractive surgery. And so I had a lot of toys to play with, a lot of bells and whistles. They were cutting edge with not only the diagnostic side of the procedure, but also the therapeutic or treatment side. I've stayed with Envision now for quite some number of years, and it's largely because it has meshed well with what my personal professional goals have been, which have been to deliver the best possible outcome in refractive surgery. And they make that available to me by providing basically all the toys that I ever could want in terms of lasers, diagnostic devices, and those type of things. They have a commitment to staying at the cutting edge, which is where I intend to be. When I joined Envision, LASIK was still basically in its infancy. It had only been present in this country really for about 5 years at that time. And so the technology was new, the experiences were new, and the company was very progressive in my view, and offered me the opportunity to explore new technologies and abilities that we wanted to be able to offer to our patients. Second to that was the relationship that the company had with their optometric referral partners, which I found to be very valuable and a key part of my practice. So those were the two key elements, I think, that brought me into what has now become Envision. So probably my key message to people who are thinking about having refractive surgery would be to not be afraid to talk to other people that have had refractive surgery, because you will get their perspective on what the experience was like and what it has done for them. Obviously, I think we're the best in the market at what we do, but really anybody who's had refractive surgery will almost always tell you that it's the best thing they've ever done. And you'll hear that from us, but it's more important that you hear it from a family member or a coworker or somebody who has what might be seen as a little more independent opinion. On the day of surgery, you will come in and we will recheck everything that we checked before. We'll look at all the measurements, all the scans, all the data to make sure everything's consistent and lines up properly. We'll look at your eyes to make sure nothing's come up between when we collected some of that data and the day that you're having the surgery. Once that has all been checked off, if you will, then you'll get to meet me, which sometimes I know is a little scary. When I show up in the room, people are like, uh-oh, it's starting to happen now, because the big guy is here with the hat on. But would like to think that I do a pretty good job of calming people down. I'll give you just enough to know about what's going to happen during the surgery, so it's not too graphic, but so that you can cooperate with me and make everything nice and simple and smooth. Most people after the surgery will either say, "That's it? I was expecting more this or more that," which they were trying to avoid. Or they'll say, "Wow, that was pretty quick," which I'll usually reply to by saying, "Well, that's because you did a good job of watching the green light. So congratulations." But once the surgery is over, we put the shields on your eyes, go over what to do for the next 12 hours between then and your first post-op visit, and then you're out of there. So it's pretty simple, in my view. So once we've met in anticipation of your surgery and gone over what more or less is going to happen in not too graphic terms, then you'll come into the laser room. We'll get you in position. At the end of the surgery, most people will usually say to me one of two things: "Wow, that's it? I was expecting more of a big deal." Or they'll say, "Wow, that was pretty quick." To which I'll usually say either, "Well, that's because you were looking at the green light. That always makes it quick and easy." Or I might say something like, "Well, we've had a lot of practice, ha 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 ha." Anyhow, we slide you, the laser bed slides you out from under the laser. We walk you out to the little post-op area we have. We'll put the clear plastic shields taped onto your face. Then we'll instruct you to go home and get to sleep. We want you to sleep for about 6 or 8 hours. If you can do that, there's a good chance when you wake up, you'll see pretty well and feel pretty good. Up to that point, you'll be kind of scratchy and teary, so we want you to try to sleep through that because it helps you heal faster and you'll tend to forget it ever happened. By the end of that 8 hours, you should have about 95% of your vision, and that will hold until your first visit the next morning, when your doctor or one of our doctors will have a look at you, make sure everything's okay, and get you started on your drops.